Pray for our hospital, okay? Now I'm going to tell you a little secret. It may sound like I'm tooting my own horn here. I was at my hospital for 2 years, and we were in a manager's meeting where we were studying effects of open heart surgery. And the manager over the open heart critical care recovery area said, we have the same 3 thoracic surgeons we've had for the past 15 years. We're doing the same procedures. We're doing the same technology. But 2 years ago, we were at the 93% success rate in open heart surgery, which is the national average. 2 years later, we're at the 97% success rate in open heart surgery. We're doing the same thing, and we have no clue why. And I was sitting there going, la-di-da-da. I mean, I wasn't there going to say, you think maybe? But in my spirit, I was going, Lord, you think maybe? You know, I don't want to take credit for 3% of 30, 93 to 97. If prayer works, and every day I prayed for open heart patients and visited them, prayed for the surgeons, prayed for the family, prayed for administration. I go, maybe. Let me tell you something else. We have 18 hospitals in Florida. 3 of those HMA hospitals are health grade 100, top 100 hospitals. That means across the nation you are good. Those 3 are the only 3 that have a full-time hospital chaplain. Now I'm not taking all the credit for that, okay? But I'm just saying, you think maybe? You think? There's something to do with that? There's some connection with bringing up. Did you know that all hospitals, way back when, were all started by churches and ministers? And somehow we got left out of the medical model, and we're just trying to get back in. So we're just saying, and Harvard and Duke and all these understand this. And it's my job to come back to the institution, getting back in, saying to CEOs and CFOs, do you think maybe this can affect? I can prove to them on paper that a paid staff chaplain will pay for itself. I just did. Did you know that sitting down as a chaplain, sitting down with a family who's got out the yellow pages for the attorneys and hot and mad, and I sit down in there and I go, I'm not here defending the hospital. I'm not here doing anything. What? Tell me. What's going on? How can I help? And they tell their story. When they get done, just thank you for listening. Everybody else wanted to defend the hospital. They had their hands on their hip, and they were going, oh, we're good and everything, and how could you call us that? And I said, tell me, what? When I leave, they close the yellow pages, and they go, thanks for listening. You can do that too. I'm just going to listen. I'm not going to defend the hospital. I'm just here. How can I help you? Tell me your story. Then you're not fixing the problem, but they're trying to give them some kind of venting time to talk about that. There are all kind of ways that we can be there for families and help them through that. Let me explain to you how hospitals get paid. You probably think that hospitals get paid, if I'm here 12 days, I get paid for 12 days. It really works what they call D.R.G's, diagnosis-related groups. My wife, who's a nurse and medical coder, tells me, Larry, your definition of this is way too simplistic. Well, I only have 2 minutes here, okay? So in 2 minutes, I want to explain to you diagnosis-related groups. That if there was an open heart patient who had no other complications, the hospital would get paid by Medicaid, Medicare, VA, private insurance, 4 days. If I was a patient that had a total hip 3 days, total knee 2 days. But if any of those patients got pneumonia or something different, there's extra days for that. I'm just talking about the basic patient who has open heart surgery get paid for 4 days. If you come in and pray for me and I leave in 3 days, they still get paid for 4 days, right? Cha-ching. Right? That sound good? But if you don't come in and pray for me, and I leave in 5 days, I only get paid for 4 days. And I still pay for the nurse and the respiratory therapist and the food and the bed to be cleaned and all this stuff. But patient didn't leave. Patient not ready to go in 4 days. Cha-ching. Right?
Tell it, Larry.
Tell it.
Tell it.
You know? That's my job to get that picture. Now, what if a patient is on life support in the ICU and we're out of D.R.G days? We don't kick them out the door, folks. We keep doing the treatment, and we're not getting paid for it. And there's a whole bunch of money that gets, I mean, we always talk about hospitals, charging too much for their Tylenol. Well, how much money do we spend in there? What if you used a chaplain? Sat down with the family, like you were talking about Mama. What if you said, why can't you let go now? Well, I just feel like God's going to get me. Why do you think that? I don't know. It's just 6 months from now, I don't know if I can live with this. Let's talk about that. And if at that discussion they go, maybe tomorrow, okay? Tomorrow. Well, tomorrow taking off life support better than 1 week from now. Cha-ching. Right? You see the... Now, I know what you thought about yourself before you came to this meeting today. You thought, I'm going to get this little badge and I'm going to be a volunteer chaplain and I'm going to come in and I'm going to pray a little prayer and I'm going to go back home and get back to my real job. Did I open up your perspective of what your real job is? Can you fathom what you could do for this institution if you came in and prayed and were appropriate and met their needs? You have no idea. Now, you thought, oh, those doctors, they have so many tricks in their bag, and I don't have any medicine to give, and I don't have any tests to give. Here I am just doing this little thing, and it's so insignificant. And I'm going, no, it's not. No, it's not. You're on the team. You're on the healing team. Joint Commission says spiritual care. Joint Commission is the agency that accredits hospitals. Joint Commission said in 2004, every hospital will do a spiritual assessment on every patient. Why? Because Joint Commission believes that spiritual care and emotional care and medical care go together, and it makes the patients get better sooner. So if it makes them get patients sooner, why aren't we doing it? So my job is, I went to corporate and I go, nobody's teaching our hospitals to get ready for spiritual care. Would you like me to help? And they go, they are? Joint Commission is doing what? I go, yeah. It's an important part. It's not a big part of the survey, but it's going to be. So let's get ready. So I'm like, look at how we're on the team now. We are part of the medical healing model. You have your place. You are just as important as the doctor, nurse, and respiratory therapists, and physical therapists, and dietitians who work all in this place as one. Without you, they aren't as good. Without them, you aren't as good as a team. So what we want to look at is how we can be a benefit for that. What is this program good for? It's good for the volunteer chaplain. It's good for the patient. It's good for staff. It's good for the hospital. First, the volunteer chaplain. You are going to be connected with your community like you've never been before. If you're a pastor and you attend the Ministerial Association meetings and you get up to date on what's going on in the community, now you're going to be connected with the hospital, which I look in many times as the hospital chaplains as the hub of the spiritual community. Because we're going to have chaplains meetings. And do you have Ministerial Association meetings that meet here? If not, why not? You know?
No, there's not. There's not. It used to be a long time ago, but not anymore.
This can be the hub, okay? You'll be connected. You give, 3-minute talks. Our hospital just got this new procedure. We just got this. We're going to be building this. We're going to be making this transition. And so you kind of be connected with that. And as a volunteer chaplain, much more. Well, missed some. You'll learn about medical information, a little bit like you did today, and helps you and your family, because now you'll understand advanced directives. You'll be able to help your church with that and just medical things. Again, don't become the expert. I mean, I'm dangerous how much information I don't know. And then more fulfilling to you as the minister. You're helping people. And my 16 volunteer chaplains, I have to tell them, don't come in today. Just not your day, and they just can't wait till they get there. Because I think I've kind of preached to them how valid they are. You're important, and they believe it now. They're dangerous now. They really believe they're somebody, okay? And that's really good, okay? You're effective in what you do. And then it helps you grow And I think there's many ways